Okay. All right, we've got question number 1.
Yes.
Which is, Dr. Daniels, what are your recommendations on weaning off of addictions, any addictions in that matter?
I think that's well, you've asked what you believe to be the right question. So in other words, you're addicted to something and you would like to quit. Let's just take a look at that. What you need to understand is your addiction is not an accident, that your addiction is actually fulfilling a nutritional deficiency that you have. And that deficiency varies depending on what the addiction is. Also, your addiction is caused by some nutritional things that don't belong in your diet. So a simple thing to get rid of, let's say you're trying to kick a habit, I don't know, alcohol, cocaine, heroin, something like that, is get rid of the sugar, dairy, wheat, and to start the meat. Just start with that. Increase your water to anywhere from ½ gallon to 1 gallon a day, and increase your bowel movements to 3 a day. It's shocking. So let's say you're hooked on, I don't know, some kind of narcotic pills for pain relief or something. So I had patients when I was practicing medicine who had that situation, and they would find literally within a week all their pain was gone. So that's the way to get rid of what is, let's say, if it's pain stuff you're taking. Well, the next question is, okay, how do you get rid of stuff that's more psychological type stuff, right? Like maybe you're, I don't know, smoking cigarettes, maybe you're drinking alcohol because you're stressed, kind of thing. For that, organ meats. So again, do the first change that I recommended. Then you want to add organ meats to your diet. The organ meats would be brain, liver, and believe it or not, bull testicles, followed by bacon. So those 4, I would start with the brain. Those 4 relieve absolutely every mental disorder under the sun. I mean, if you're anxious, nervous, depressed, stressed, whatever. And don't give up the vegetables. Continue the vegetables, continue the water, and continue, to not eat that other stuff. And that's pretty much it. And what will happen is you'll just find your desire for your drug of choice just goes away. Or even worse, you won't even get high when you take it.
Awesome. Okay, next question is, the area underneath my eyes are puffy and sunken in. How do I go about correcting this?
Go on a 0-carb diet. That's it. 0 carb. So that'll be no, basically it would be keto. It'll be keto diet. In other words, no sugar for sure. No sugar and no bread, pancakes, bagels, cookies. Cut all of it out, and the puffiness will go away, and the discoloration will go away. It's really neat. Now, do you have to stick with it forever? Not exactly. So I would stick with it until you get the results you want, and then you can gradually reintroduce. Start with your favorite carbs, please. And then when it comes back, you have to back off a bit. And so there'll be a certain amount of carbs you can eat that won't cause you any problem.
Okay, next question is, hi, Dr. Daniels, what should I do when I'm sick with a fever, headache, and a cough?
Well, the simple answer is mix a teaspoon of turpentine with a 1/4 cup castor oil, drink it, and either sit in the toilet and wait as you drink more water, or just go to bed. And the fever and other symptoms will usually be gone by morning.
Okay, next question. Hi, Dr. Daniels. How will you cure the recurrence of mastitis in lactating women that have oversupply?
Well, the first thing you've got to do is keep your breasts empty. That's important. And one thing I'm a firm believer of, just keep that kid latched on and just let him drink until he bursts. And then you can pump the rest to give it to the bank, the the milk bank. But another easy way is just to cut back your supply. And you can do that by eating sage. Now you have to be careful because if you eat too much sage, it'll cut off your milk supply and you're done. So I would use a very small amount, like a 1/16 of a teaspoon in some hot water. And then your milk supply get less and less and it'll dry up.
All right. Next question is, how does a person stop getting UTIs?
Interesting. The first thing is stop going to your doctor. So if you've had many UTIs and you've received antibiotics for them, your UTI sensation, burning when you pee, is caused by the residual antibiotics in your system.
Mm.
So you have to separate that from, are you really having another UTI? Fortunately for you, technology has progressed. You can only go to Amazon and spend $15 for Eurostix, Urostix, and it's a stick with a bunch of patches on it. You piss on it. It literally tells you if you have a urinary tract infection. You're looking for leukocytes. It actually detects leukocytes. And leukocytes and ketones, I believe. Anyway, those two things will be present. If they're not present, and it burns when you pee, then you don't have a UTI. You have a chemical irritation. The most common cause of chemical irritation is your toilet paper. So switch your toilet paper to something that is totally chemical free. I can't tell you the urinary tract infections I cure it by changing the toilet paper. I know, it's not very exciting. The next thing to understand, okay, so you've changed the toilet paper. Sake of discussion, let's say the UTI is still there, and let's say you pissed on the strip and it was bacterial. Number one cause is E. coli. It comes over from your colon due to constipation. So increase your hydration, poop 3 times a day, and it'll go away because it's just bacteria. So in other words, your UTI is caused by your own good bacteria. And your doctor gave you an antibiotic to kill your own good bacteria because they were in the wrong place. They only get in the wrong place because you're constipated.
That's right. Okay. Next question is, if I'm consuming large amounts of skin collagen, pork gels, pork skin for almost 2 years and have not resolved sagging facial skin, what else would you recommend to resolve it? Is this a bone loss reabsorption issue?
I don't know what you mean by sagging skin. She's jowls here is what she's saying. Okay, chewing gum. So if you chew gum, you exercise these muscles and you firm them up and you get more pull. So your problem is that your mouth muscles have not been getting a lot of exercise. And that's perfectly plausible because many people, they're on a diet, they're not eating as much, they're trying to eat less. Even worse, they're eating boneless, skinless meat, so they're not using their jowl muscles to chew, they're not chewing the meat off the bone. And many of us feel that chewing gum is low class. So the thing to do is chew your gum in private, see if you can get in a few hours a day of gum chewing. So when I worked on my teeth, I found I needed to chew xylitol gum, and it really toned up my cheeks.
Okay, perfect. Next question would be, what is like a natural remedy for body odor?
Interesting. So let's say the body odor is coming from just your whole body. It's just exuding this like really obnoxious odor. So what's really happening when you have body odor coming out of your body like that is your immune system, due to malnutrition, is actually decomposing and dissolving your bones and your inner organs to scavenge parts and pieces for your vital organs. So what I have found works just shockingly well is bone slurry. And to make a bone slurry, you need to buy pork neck bones, not smoked, fresh. So pork neck bones, and I like to throw in some chicken bones for flavor. So you've got pork neck bones, chicken bones in this pot. Pour in a 50-50 white vinegar water solution, and I like to pressure cook it for about an hour. Put it in the blender, blend it, and then strain it. Now you have a bone slurry. And try to eat about a 1/4 cup a day of bone slurry. And it works almost immediately. You'll notice a decrease in body odor within 24 hours, like by the second dose.
All right. Last question is, I would like to take turpentine, but I'm a little bit nervous. What would you recommend I do to get over that fear?
Well, read the Candida Cleaner report. That helps. And read the testimonials online about people who have tried it. That helps. And what I did was I had all my bills paid. I had enough money in the bank to take care of the kids in the event of my death. I wrote my will, and I said, well, here goes. If I die, then things are handled. And here I am, I don't know, 20, 30 years later. Actually, more than 30 years later. So I say, make preparations so if things go wrong, that's it, everything's handled. And then what I would do is, the Candida Cleaner report does make recommendations, but I would start with 1 drop, just 1 drop. And put 1 drop on a sugar cube and try that. And then you'll survive it. And you'll say, oh. And if you want to increase 1 drop at a time, that's fine. But you might at some point get bold and say, I could do a 1/4 teaspoon.
Okay.
So that's how